Good evening. Hey, Nancy, how are you?
Good. How are you?
Good. Did you have a good spring break? Did you go anywhere? Did you do anything?
We were at the beach, which is always nice. It's my recharging place, kind of off the grid. Love it out there.
I
How
have a
about you?
question. Yeah, well, I went to Las Vegas actually.
Ooh, exciting,
So,
exciting.
yeah, it was. We saw a bunch of shows and just chilled. And you know what? I was very surprised. We were there for almost a week and I didn't see, and walking around, there were a bunch of people. I didn't see any trans youth. None. Not one,
Interesting.
right? Of all places, right? Las Vegas.
I would think, yeah.
Yeah. Yeah. So let me ask you a question. Do you watch news on your vacations?
Unfortunately, I do take a peek at, social media every once in a while. I don't ever watch cable news, though. I mean, to be fair, I don't watch it here either.
But
But
you totally detox off the news when you're on vacation.
I try to get away from it more, but I am kind of a news junkie in the sense that I would like to keep tabs of what's going on. And I do have my normal morning routine of going through 5 or 6 different sources that I like to read. So, but I try to stay away from it more during the day. Yeah.
Okay. So you put a limit on it. That's good. And I put a limit on it. In fact, I was going to go ahead and do a whole moratorium on looking at anything for a week. But the second day I got out to Las Vegas, a whole bunch of news broke, and we're going to get to that now. And I mean, it's what we get for publishing a story a few days before you and I went out of town. And I'll put this story up right now. It's about North Carolina's second largest hospital system. The plan to flood rural areas with what they call gender affirming care, what we call child sex change procedures, and that would be ECU.
Mm-hmm.
So we know that UNC is doing it. We've been talking about that. We're going to put some stuff up about UNC, but ECU is the #1 hospital in this state, did you know, for training family medicine doctors.
Yeah. And I think they're like second in the nation or something pretty high up there. I mean, that's what their reputation is not just the medical school for North Carolina, but, compared to UNC and Duke, it has more of a emphasis on training rural in-state physicians who are going to practice and serve the more needed the areas that are more in need of medical services, as opposed to like the bigger cities, which may have more doctors per capita, that type of thing.
Right. So you just hit up on that magic word, rural area. So North Carolina is second only to Texas in terms of rural territory. There's about 60 counties that are considered rural, and ECU just got $250 million in 2021, 2022, that range, to increase the share of family medicine doctors or rural doctors. And we have a healthcare shortage. It makes sense. So they just got this money from the taxpayer. And then lo and behold, what did they do right after that? They opened, we've been talking about this for a while, guys, the Pride Clinic for 4-year-olds and up to change their gender or change their sex. This would include, according to ECU's own literature, giving the hormone blockers, giving the cross-sex hormones, and giving the conversion therapies, right? Converting to, I know who I am, I know where I came from, etc. God doesn't make any mistakes, to, I wonder if I'm actually a girl, a boy, what mommy tells me. Anyway, so ECU brazenly published a paper in January with these 3 sex change doctors. And the plan was basically a blueprint to spread, really to flood all rural areas with a real tight network to teach children through telemedicine, to give them that conversion therapy, to have family medicine doctors trained to do this. ECU is already training family medicine doctors to do this, and really just to flood the zone, if you will, with these dangerous drugs, and kind of like a pill mill, right?
Yeah.
Like a pain clinic, where they
also said in that paper, I believe you pointed out, Sloan, and I found it in that paper, review paper, that they were going to work with schools as well.
Yes.
So yeah, they're brazenly saying it. They've said it before in their convocation, the faculty convocation from ECU last year, where they said they were going to revolutionize the medicine training with this Pride clinic, and they do the safe zone training in schools, and they're saying in this review paper, which actually wasn't very good. Review papers generally are the easier types to write because you're not running a novel experiment or anything, you're just reviewing what's already out there. But they certainly were very one-sided and not very open-minded in reviewing the information about gender dysphoria. But yeah, they're brazenly saying, hey, we're going to go out into the schools and deliver this care there and work with schools to emphasize this type of gender affirming care, which, you know, has multiple problems associated with it, as we've known from the experience in England. Yeah.
Well, to be clear, ECU is already doing that. It's something called the safe zone training. UNC is already doing that, called the safe zone training. So let's think about this, guys, as a broker network, right? I mean, if you've ever bought insurance, you don't just call Geico, you call your local broker, and your broker will, well, I've got this service that would cover this would do that. And so ECU wants to broker those services, and UNC does, all over North Carolina. So if you need therapy first, you go there. To be clear, name changes, therapy is the first stage of sex change, right? When you want to go to chemical castration, we can prescribe it through here, blah, blah, blah. It's a whole network. And guess who makes money? Either the ECU system, in this case, could be the Duke system. They also do it, to be clear, or ECU. So we leave town. I think the second day we were gone. I texted you. I'm like, okay, great. We're going to call this the anti-ECU grooming bill. Of course, it applies to all the systems we've talked about. It is Senate Bill 560. I'm going to get this up right here, and then we're going to talk about it. So the first thing that this bill does, and some of the others we're going to review, is it defines what we're talking about here. So cross-sex hormones, that would be, I guess, if you had a kid beyond what's called a Tanner 2 stage, and that's a stage in puberty. I think it begins at what age? 9?
Oh gosh, those are things I always have to look up. I don't memorize them. Yeah, it's early on. It's like preteen
Okay.
age.
So at that stage, they would want to do something called puberty blocking. So they would give a drug. Most frequently, it's called Lupron. Lupron, by the way, has a black box warning on it for lots of side effects. So they would stop puberty typically, and we're no doctors in this arena. So, and then they would give cross-sex hormones either at the same time or wait for that. So this bill says, look, here's how we're going to define gender. They define biological sex. Check this out. Gender is a psychological, behavioral, social, and cultural aspects of being male or female. Okay. So that's, you know, how you feel. All right. And this bill points out, as the others do, that look, there are doctors pushing a physical, irreversible medical change for feelings. And this is really the only condition in children, at least, that this is how you treat it. So let's move on. The key thing in this bill is this: if you want to have state funds, then you will not do these procedures. And it says in any way. And so my reading of the bill, and I think they're going to strengthen this part of it, is that ECU, UNC, et cetera, if they want to take their training, their family medicine training, and infuse it with this gender madness, they will not get state funds.
Right. That's a big one. And that's the most important feature. And we need that to pass. I understand that, you know, there are other aspects of the bill people may want to change or improve upon, or feel like it's not strict enough, but this particular portion of the bill is what we want and what we need the Republicans and those common sense Democrats to get behind and push forward and pass. Because without the funding, I mean, if ECU or these other state institutions start practicing this experimental and dangerous medicine, contrary to the oath to do no harm, then yeah, take the funds away and it'll stop. And that's what we need.
Yeah, well, we definitely need that because look, when you are taking $215 million and you're telling John Q. Public out there, and by the way, this was a stated reason, we want to train more rural doctors.
Right.
That was just part of the truth. The other part is we're going to build on to Brody Medical School, a whole wing of this. Okay. And in addition to that, we're going to infuse these rural areas. Nobody signed up for that. There's got to be truth in advertising somehow. So let me tell you what a big deal this would be. Even I believe my understanding is even Levine Children's Hospital, which does these regularly in Charlotte, part of the I think the Charlotte medical system. That system still receives state taxpayer funds. So that is still going to be a big deal. And look, if you can't practice it on minors, you're not really going to be able to do it. Now, is this a total ban on procedures? No, it is not. So let me tell you how that would work. In Charlotte, in particular, there are a couple of private clinics that do the pediatric sex change operations. I believe they also prescribe some of these drugs. But look, if you've got only maybe, I'm just guessing, a dozen in the state centers that do this, Nancy, you're not going to be taking Medicaid, right? You're going to be taking cash on the barrelhead. You're going to be taking top flight folks to do this on. And what this bill does is it breaks up that cartel that ECU has, where they are seeing patients all over the rural territories with telemedicine. And by the way, only having a counselor doing telemedicine, that means a social worker possibly. So it's changing that. And then it is also making sure that, if, let's say, if there's a private clinic that wants to serve patients, well, here's what has to happen. They have to have a pediatric psychologist, somebody that's very well trained, refer a patient to an independent doctor. So no more can ECU make this money by having a counselor refer to an in-house provider, refer to a in-network here. That is a huge cash cow, upwards of $100K per year in perpetuity.
Right.
So
Right. No, it needs to be
that.
broken up, and these people work together and talk together. So you're not truly having an independent assessment. And that's what's important here, is to be able to get, more than just one institutional opinion on the treatment for this complicated issue.
Yeah, and it takes the profit motive out of it in a way, because right now it's predatory, right? You could say it's being done to advance medicine, but you'd be lying through your teeth. And one look at what's going on in the UK, Sweden, and other places will tell you that. As a matter of fact, this bill kind of codifies that, because it has a disclaimer that not only the kid must sign, the parent must sign. It goes through, I'm going to put this up on the screen right now.
Mm-hmm.
So, I mean, look at this disclaimer. It's talking about everything that the UK has found, everything that Sweden has found. It's putting up there so everyone can see the unproven nature of this treatment and the deleterious risks inherent in that.
Yeah, it's all the stuff in there that wasn't in the ECU review article that the 3 quote unquote gender dysphoria primary care doctors avoided putting in their review article to make it all seem hunky-dory. And that's what's happening, unfortunately, is medicine is getting skewed politically. And so you're only hearing certain viewpoints, certain takes on very important issues from physicians. And I find that especially atrocious and dangerous. And I find it akin to malpractice, because in my mind, it's as simple as, if you're going to recommend a medication for someone, a drug, even if you want them to go on it, or you think as a physician that this will ultimately save this person's life, and so you feel very strongly about it, you're still going to tell them what the side effects are. You'd be derelict in not doing that, because ultimately it's the patient choice. So even if I want this patient to go on a certain drug per se, I'm still going to tell them, to expect these side effects or consider these side effects, and they might be minor or major or whatever, but I'm going to educate the patient about the other side of this drug or treatment. Here, they're not doing that. And this bill tells them that they have to, says you have to include this information, because we have seen over and over again with the push of DEI in medicine that is forcing doctors to be silent about certain aspects of ideas and treatments, where they don't say, where they only promote one perspective or one ideological framework for something like, say, gender affirming care, where they don't even talk about the problems with gender affirming care. So that aspect of this bill that forces doctors, and it's really disappointing for me to say doctors have to be forced at this point, that forces doctors to acknowledge some of these side effects, is very, very important.
Yeah, well, it's like a buyer's beware. And then it also has a 15-year provision. So it extends I believe it extends the time past where you can sue, statute of limitations is what it's called, for 15 years. But look at, if someone is signing that disclosure, what it does for physicians as well is it kind of covers their ass, right? Because if you sign something that's that ironclad and it talks about not only risks but pretty commonplace occurrences with these drugs, I'm not so sure that you would have cause for action.
Yeah, I'm sure there are people who are creative these days and can get around whatever, but just to me, as a speaking from a training as a physician, it's really disappointing these days that to see other physicians not be open-minded to discussing all of the risks and benefits, even if it's not not in line with their own personal ideology. That's the whole point of being a physician, is that you rise above your own personal ideology and discuss and are willing to discuss the risks and benefits regardless of what you feel personally. And that's no longer happening in a lot of these places. So it's good that the legislature picked up on that. And it's a really strong aspect of this bill that this information has to be included, because we are already seeing from ECU that they don't include this information. None of this information was included in the review article that they recently wrote. They have no intention about being open about this stuff. It's not on any of the gender dysphoria websites for Duke or UNC. You're not going to find this information. They are deliberately lying by omission. So thank you, legislature, for picking up on that and putting that into this bill.
Yeah, I mean, you and I had a discussion about how dispiriting it actually is to mandate ethics in a profession that, it should be inherent in everyone's behavior and the way they comport themselves. This, I mean, in history, we've seen this type of thing before. We've seen it more recently with eugenics, right? Where there was it never was based in science, in my opinion. And it was perpetuated for a long time, and there had to be a law to come in and stop that. And now we're dealing with, legislating morality, which is not a position we want to be in, but damn it, I mean, we're here. We are in full-throated Marxist takeover of medicine. And in my opinion, nowhere is it more present than in North Carolina with these North Carolina system hospitals.
No, I agree. When you ask me my opinion on these bills, that my immediate knee-jerk reaction is, well, I don't like them, because we should be able to trust our physicians to say what they need to say and do what they need to do and be good moral citizens. So I don't like it when my initial response is, I don't like it when the government intervenes, even if it's something that I find conducive with my own values, because it could always be flipped the other way. But we are at that point where we have seen so much evidence now where they're not being good moral citizens, where they're not discussing the true balance of risks and benefits, where they're only leading people down one path without giving them information about that path. And it really bothers me. I don't like it. And if they have to be forced to put these disclaimers and this information in, then so be it at this point. I'm not sure what else to do.
Well, it speaks to there's not an adult in the room, and the lunatics are running the asylum at UNC Med School, at Brody Medical School, and others, where there are a bunch of morons that are just kind of bowing to whatever. And the legislature is saying, damn it, if we have to be the de facto medical board over there, we're going to do it. So let's move along to another bill, which is very similar. It's called the Youth Health Protection Act. This was something that was enacted, drafted and put out there the last legislative session by Senator Hayes and Sanderson. Also, Senator Buck Newton has signed on to this bill as well. And it's kind of similar to what we just talked about, but the age, the last session was 21. Now they're saying, look, the age is going to be the age of majority, which is 18. What I like about the bill is, I'm going to put this up here. It's kind of, it's affirming, if you will, just to borrow a noxious word here. It's saying, look, these things that permanent medications are being given for are transient in nature. In other words, there are some children who have what's called identity disturbance. By the way, it's not always in gender. We see it a lot. I mean, you know, kids that are pathological liars about their past, or they're this or they're that. I mean, that is also an identity disturbance. It's pretty much being an adolescent in general. So it's just saying, look, this is a transient thing, and to provide irreversible treatment is now going to be illegal. So let's get into the legal part of it. So part 1 and 2, it's like, look, any surgery to remove healthy sex organs, breasts, etc., and then also any surgery to put them onto where they don't belong. So, you know, breasts, etc., you get the idea. And it's just, it's saying, look, this is not going to be allowed. Now, here's where it gets the interesting part, Nancy. This is talking about the counseling part of it. So I'm going to read this to you. It's unlawful for any medical professional, mental health care professional, blah, 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 to knowingly engage in conduct that aids or abets the practice described in any subsection of this to a minor. This is not a moratorium, moreover, on free speech. Thoughts?
Again, it's like I said with the last bill, where I have to be honest, my initial thought is I don't really like legislators stepping in and telling counselors and medical professionals, you know, what they can and can't talk about. I would like that to be a self-determination within the medical profession, but the medical profession, unfortunately, has run amok. And like you said, the adults are not in the building, and their morals have been subjugated to this ideology, to the point where they're not willing to talk about in balance, you know, the problems with these issues. So the legislature is stepping in, and that's what happens when you aren't responsible moral citizens. When you aren't doing your job responsibly, you lose you know, some of the freedoms that you had previously had. So, you know, that's kind of how I feel about it. In the end, if it protects the innocent minor from being taken advantage of or not being told all of the information, then I'm for it. I am disappointed that, you know, that increased legislation has to do this. I'm not a fan that we're at this point, but at the same time, shame on the doctors for not being the adults in the first place.
Well, I want to jump in here with this. So you're saying, look, I don't, you know, trust the physician, trust the counselor. They are the learned professionals. Don't get in here with it. And here's the thing, guys, do not allow the left to tell you, hey, they're taking away speech. They're taking away the conscience. They're taking away, because the left has just put up a bill that is an anti-conversion therapy bill. They've just done exactly what you said. Right. So and the bill says, look, if a teen presents and they're gay, counselor, you're not allowed to influence them not to be gay. So this is just a bill on the other side. Mm-hmm. Okay, so this is the bill that says you can't, you know, hoodwink them into feeling they're not a particular gender, and you can't go the other way. So do not, guys out there, do not allow the left to tell you that Republicans are doing anything novel here. because the
Right.
left is also doing that as well. They put their own bill up. So yeah, I mean, freedom of speech is great, but if you are, and here's the difference between speech and actions. Actions mean I'm a therapist that is calling a physician, let's say at ECU, I'm calling a physician and coordinating care. That's taking the action, right? That is not in the purview of the facilitator there, the counselor, which brings me to another part of this bill that I like, that you're going to see it in just about every single bill here that's dealing with this gender madness here. It has a provision that says, I'm going to put it up here, but basically it's saying, look, any government employee, okay, that's technically a teacher, not, I mean, it is and it isn't, but it just refers to any, anyone I would imagine that's paid with government funds that has these secret gender plans that we see in schools, or has kind of a code of secrecy that keeps this gender or desire to change genders under wraps away from parents. That's not going to be allowed.
Right. No, that's important. And that is something that should be, under the legislator's purview, that these entities can't keep things from parents, because we know parents have the ultimate power over health and education decisions for their children. And again, I talk about how I wish we were in a place where doctors could regulate themselves and do the right thing morally, and not have to have a legislature step in and tell them and give them guidelines or frameworks for what they can and can't say potentially to patients. But what we have here in these bills are common sense things. I mean, it's not like the legislature is coming in and telling them that they can't say anything about whatever, but these are common sense. These are common sense ideas that the doctors should be saying anyway. So I guess what I'm saying is, like, I being a doctor myself, or having trained as a physician myself, it pains me that my own profession can't morally regulate itself, that now our legislature has to step in and do it for them.
Right. Yeah. I mean, but at least these provisions are, I mean, pretty serious. Republicans are showing, and to your point, some sensible Democrats are showing that they're not going to put up with this anymore. We are not going to flood the zone with healthcare providers that are prioritizing actually doing harm versus not.
Right. And these are common sense. Yeah, these are common sense bills that are presenting what 20 years ago was common sense medicine. Like, you're not going to give these experimental drugs with a huge side effect profile that are not FDA approved to young children, where it's been completely untested and they likely have a temporary condition. That like that, not too long ago, it was pretty common sense that you wouldn't do that. So yeah.
So there's also the medical board will police this along with HHS. And the medical board, believe there's 12 people on there, 10 of which are appointed by Cooper. So, always, there's nothing perfect, right? There's nothing perfect. So you've got one bill, the Senate bill we just told you about, the Youth Protection Act. It will ban the procedures altogether. You have the other provision that will pretty much stop state funding into this. And the interesting thing about the Youth Protection Act is going a step further and saying, okay, even the state health plan, we're going to still, let me make sure I've got this correct. Yeah, if you've got the state health plan and you're a teacher's kid or what happens, whatever, it's still going to be forbidden to do that. So that's going to be very interesting legally, because we've been here before, right? I mean, Dale Folwell helped to stop that. And I guess the Fourth Circuit blocked him from being able to do that. So we will see what happens with that.
Mm-hmm.
Okay. And it says the whistleblower protection also in this bill, in the Youth Protection Act, it means this. So let's say that, and we see this all the time, Nancy, let's say there's a nurse who sees this going on in the clinic where parents are being shielded or these drugs are being given out. the nurse goes and you know, whistle blows basically and loses her job. So this has ironclad whistleblower protections that has been needed for a very long time.
Yes, and I can tell you from direct experience, people are very afraid to speak out in the medical profession. Physicians who have a lot of experience, very afraid to speak out, will not speak out, even anonymously will not speak out because they're that afraid. And to be in that state today should wake everyone up and should be very scary for everyone, because if anyone should be able to say anything, it's a physician. And when they're scared, that's a problem.
Yeah, so we need people to police their own profession. Got to have that. Teachers got to have that for doctors, etc. And you're right, people are getting fired, canceled, and worse left and right. And the left has made it known. I mean, they're going to come out after anyone that speaks out. So, you know, why would you? So this bill makes it okay to do that. So let's move on to the much heralded, the House version of the Fairness in Women's Sports Act. And that would be, let's see, House Bill number 574. I'll get it up here. Okay, it's very basic. The most glaring thing is each team shall be expressly designated by the biological sex of the team participants as one of the following: males, females, co-ed, or mixed. Nothing more spectacular than that. It's pretty obvious, right? Okay, so yeah, that's it's going to be interesting then, Nancy, because as we reported a number of months ago, Lambda Legal, which is an LGBTQ radical group, came in here a couple of years ago, sued North Carolina because, horror of all horrors, you can't change your birth certificate. If you're born a male, it's on your birth certificate, female, etc. So now, because of a consent decree or an agreement between HHS and Lambda Legal, as of last summer, you can go up and get a new birth certificate if you've got a letter from a counselor. That could be a licensed practical counselor, it could be a social worker, and get a new birth certificate. So how's this going to work out? How are they going to verify a male versus a female?
Yeah, I don't know. You know, again, it's just amazing that we're at this point where we're talking about these things. You know, some of the criticisms I've heard from these sports bills in North Carolina, not just yours, Sloan, which I think is very important and a good one to ask, and the legislature needs to answer that. But also, you know, people say, well, it's only a few people in the state of North Carolina. It's only like 15 or, you know, a dozen people. Like, why are we emphasizing this? But then you look at the events while we were on break last week, Sloan, with what happened to Riley Gaines. And,
talk a little bit about that. Talk a little bit about that, because people are now just coming back from break. They're seeing the footage. I'm going to put the footage up. Tell me what.
Well, I mean, from what I can tell, you know, Riley Gaines is a swimmer. I want to say for Kentucky, but I could be wrong on that. A collegiate swimmer, Division I, was in some of the races involving, you know, Leah Thomas, who is born a male and now is, you know, considers himself female and raced as a female.
It's a dude
and beat a lot of women. Yeah. And she very bravely, after looking back on considering her experience, decided to start speaking out on this. And she isn't necessarily a political person, you know, she's a college student, moderate person, not really invested politically in anything, but wants to talk about how do we protect women in sports and make them feel safe. And a lot of it stemmed to not just to losing to a biological male, but changing in the locker room, for example, with someone who doesn't share the same anatomy, which was very uncomfortable and being forced to do that. And so she has taken her story to the public, talking about these issues. And I guess she was at, I can't remember which college on the West Coast now, in California, and was basically mobbed after her talk by a group of leftist radical college students, I suppose, and trapped in a room.
Basically
And
kidnapped, held
yeah, for
hostage.
3 hours, and the
Right.
police around her couldn't do anything because the mob was being that egregious. And
The left
where
thinks that's okay. Yeah.
I'm sorry.
The left thinks that's okay.
Yeah,
They justify the means. If
right.
you're denouncing this stuff, if you're an advocate,
It's okay.
yeah.
Yeah, the rules don't apply, laws don't apply because they're racist. And so, if you're doing it for the right reasons, the laws don't apply. And the police felt that if they did intervene, it would be something that would be overtly violent, that would make the situation worse, I guess. So she was trapped in this room for 3 hours. If you watch the videos, there were some very violent aggressors on the left side, punching her, hitting her physically, calling her very disgusting names, just atrocious behavior. It violated her rights. She eventually was able to leave safely, but had feared for her safety for a period of time. And then afterwards, I guess the college came out and made a statement and basically praised the protesters and said they were being peaceful, which it seems to me, if your speaker is actually physically hit by someone, that's not peaceful. And the people who are there supporting that, are what's the favorite term, complicit in that behavior. So you can say, yeah, just this only relates to 15 people in North Carolina, and it's a small minority of people, but look at the national uproar it has caused and the lives it has changed, and how berserk people have gone over this. So I think it's right for the legislature to try to lay some groundwork and ground rules for this.
Right. I mean, look, there's got to be adults in the room, and that means everybody. I mean, we're going to talk about that in a second. Look, this organization has been advocating for more than 2 years now for exactly these bills. And so now we need each and every one of you to kind of rally around our legislators. I'm going to tell you more about this bill, this particular bill, and I'm looking at the Senate bill now. This is SB 631. This is Corbin. Corbin has a district where an athlete has actually gotten hurt by a dude playing volleyball. Corbin, Sawyer, primary sponsors. This is also protecting what we just talked about, retaliation. Let's say that a student comes out and says, look, this is a dude, he's changing inside of the girls' locker room, is making me uncomfortable. This retaliation will not be tolerated by an employee, etc. Now, here's where it gets interesting. The State Board of Ed will monitor each school's compliance with this, and they're not allowed to delegate it to a third party. So the state school board, just so y'all know, is made up of Lieutenant Governor Mark Robinson, State Treasurer Dale Falwell. We're fine with them. We've got Amy White, who is a Republican, and Olivia Oxendine, that's a conservative. So those are four, okay? The rest of them are crazy. And the Eric Davis, who's the, yeah, I mean, Eric Davis.
No, it's true. It's great.
Crazy as hell.
Yeah.
And Eric Davis, the co-chair, is inept. And speaking of inept, there is another bill here I'm going to get to, another bill that has Transparency in Sports Act. Wait a second. Let me get to that. Geez. School athletic transparency. And this is Senator Sawyer, Johnson, McInnes, SB 636. If you're keeping track, I'll throw this up there. And so you'll see right here, rules for high school interscholastic athletic activities. The state board shall adopt rules governing this. Okay. And this cannot be sloughed off. And it includes biological participation requirements. Again, this is the third bill now. We've got a House bill, now 2 Senate bills that reaffirm, look, men on men sports, girls on girls sports, that's it. And then when we go down here, here's a problem. Talking about inept, Superintendent Catherine Truitt will enter into a memorandum of understanding with nonprofit organizations that are going to administer and enforce these rules, Nancy.
Right.
So
Yeah. Well, Her
She's not
choices
keeping
have
predators.
not been that great.
She refuses to keep predators off of the list of certified teachers. So if that's not a priority, how is this going to be?
Yeah, and she brings in frameworks from institutes which, are directly contradict this, like the National Equity Project, which is very much for, gender, transgender rights, or however you want to call it, this reversal of biology. So how, yeah, I mean, how that will be monitored by her, based on her track record so far, I'm not too enthusiastic about that.
Yeah, and no, not at all. I mean, so now we've got 3 bills. We've got a House bill, 2 Senate bills that say, look, there will be no biological males on female sports teams. So I think they're pretty serious about that. We've got 2 different bills, one on the House side, one on the Senate side, and I hear another one's coming out on the House side, maybe today or tomorrow, that's going to also reaffirm that, if you will. So, these bills, some version of it, whether it's preventing the chemical castration, mutilation, and keeping boys off the girls' sports team, they will be passed.
They better be. And I hope that, like I was saying before, Sloan, before we started recording, I hope that the actions of the Tennessee legislature this past week, where they kicked out some members who misbehaved and who started an insurrection in their state capitol building, will inspire our Republicans and any common sense Democrats to stand up and to say enough is enough. And we need some adults in the room, and we need some logic and order, and restore biology to, our programs, and get these bills passed, especially Senate Bill 560, I think, which talks about the state funds for institutions that practice the gender affirmation, and putting in more restrictions and making sure that they talk about the side effects of these treatments, if you can call them treatments, I think is especially important, and very wide ranging, and we need to nip this behavior from ECU and these other state institutions in the bud, because they have a very wide reach, and we've already seen their duplicitous intentions with receiving 200 million and then for supposed rural care, and then turning around and doing a very specialized experimental clinic. So
lying through their teeth. In fact, the day before this bill was put up, I got a text message from some constituents of ours in Pitt County, and they said, hey, Sloan, everywhere I go, I'm hearing about the story that you wrote, and I'm hearing that it's not true. And I said, well, I mean, you can hear whatever you want, but the evidence is in the actual story. We had 10,000 reads on that, by the way, 10,000 reads in a week, which is pretty darn good. And so, it's been interesting. It's been frustrating, actually, because all along the way, ECU and its puppets have denied it at the expense of children. But, somebody's listening, right? Senator Jim Perry's listening. The other authors of this bill are listening. This bill, this 560, Senate Bill 560, it takes care of the problem that we wrote about in that very piece last week in totality. ECU will not be able to lie to people anymore. Look, if they're lying to the public about this and gaslighting us, can you imagine what they're doing to parents?
Right. Exactly. It's disgusting. And I think that hopefully the Republicans, and again, anyone who's common sense, I hate to specify a specific party, because I certainly have plenty of issues with the Republicans too, but anyone who's common sense can get behind these bills and get them through and protect our kids.
Yeah, absolutely. So let's go over, we've got one more, I think, the medical ethics bill. Let's see. Do you remember the parts of that bill? They kind of reiterate the same sort of thing.
It's more of a protection for health professionals, in terms of not forcing them to do procedures that are in conflict with their own conscience or religion. And I want to say it mentioned the word abortion. I can't remember. I could be wrong. Fact check me. So basically saying that like insurers and institutions can't force individual physicians or physician assistants or whatever to perform procedures that they are personally morally opposed to, which seems fair to me. And, you know, even from a patient perspective, asking for that procedure, I wouldn't necessarily want a physician who is morally opposed to it performing it anyway. So it
Yeah.
seems like it kind of makes sense to me. And, you know, I think it could apply whatever issue is, if it was written for abortion per se, or I think it could also apply to gender affirming surgeries, because I think in one of the articles I've written for American Thinker even brought this up, like how soon is it going to be before surgeons are forced to perform these as part of their practice for, say, an institution like UNC?
Yeah. Well, yeah, I mean, the DEI quotas. I mean,
Right.
they're forced to go to these trainings. Why the hell would you go to a training as a physician, or pay for these trainings, or force a physician to go to the trainings if you're not requiring them to do the actual procedures?
Exactly.
Yeah.
Yeah, exactly. So, you know, it's not too far off where that's gonna happen, where if a patient comes in and demands a surgery like mastectomy or whatever, because they want to change sexes, and the surgeon says, you know, I'm not okay with that morally, or you know, I'll find you another doctor, and then that person decides to sue that particular physician, just like with the cake baking thing, you know, in Colorado, where he doesn't want to bake a cake for a specific type of event, and then gets sued because it goes against his moral religious consciousness. You know, I think, you know, a doctor should be able to be willing to find another doctor that person can talk to, you know, if this individual doctor doesn't want to treat them. I don't think you should just leave people hanging, but at the same time, you should be able to say, you know, I am not the right person for this procedure, and so let me refer you to this person. And again, this kind of bill makes sense. And I think as medicine becomes more and more of the medical industrial complex that we're seeing, where it becomes less and less individual patient physician relationship, and more of these hospital-based, institutional-based systems that are eating up all the private practices, and private practices can't compete anymore, the individual doctor needs more protections. Because they're getting swallowed up by these huge corporate, you know, it's turning into
like ECU Health, like
right,
ECU
corporate
Health,
entity.
right? But that's the whole thing is to, you know, Nancy, you've done a lot of work in exposing all of this DEI at UNC. Now, when we go to ECU, DEI, by the way, is diversity, equity, inclusion, and it's, you know, we see it play out in 3 different areas. In admissions to school. In other words, we've got a quota we're going to fill. We're going to do away with MCATs. We're going to do away with merit. We're going to accept these people in because of their skin color, whatever. We've got that. We've got in the way that they are trained. Okay, they've got to take so many classes. They can't use specific language that would offend, all of this stuff, microaggressions. And then we have it in treatment. Now, nobody wants you to know about the treatment. They want you to believe that it's just in medical school selection candidates and faculty candidates and training. That is a lie. And we've exposed that lie, particularly at ECU. ECU practices DEI with this gender madness medicine that's very dangerous. So their output is that when we look at UNC, it's a lot of the race-based stuff, right? It's the you know, if you're on time, if you're a perfectionist, if you're objective, then you're you know, you're a white supremacist. But the dangerous part is that we've gone right from, and I don't know if they've done these trainings yet at ECU. We don't, well, actually we do have information they've done it, but it's skewed almost exclusively toward irreversible medicine. One of their trainings at ECU was they're hard targeting Black women for abortions. That is the whole subject matter of something called reproductive justice that they train a lot of the doctors on. That was called eugenics the last time I checked, but go on with your bad selves.
Yeah, going to medical school 20 years ago, that was not, I don't remember any kind of screening at all like that. It was not a part of reproductive justice was not a part of the curriculum,
mean,
and it would have been
right.
weird if it was. And it's
Yeah, it's
inappropriate.
inappropriate. Here you're taking family medicine doctors, which by the way, on the totem pole of doctors, you've got PAs or physician's assistants. Then you have family medicine doctors. They don't get a whole lot of training. So there's not a whole lot of room to do this stuff. They're not a specialist.
Right.
And so, but their output, their embodiment of DEI is this gender stuff. And they're going to make a whole hell of a lot of money doing it. Look, ECU recently closed 3 rural healthcare clinics because they said they were losing money. And they used it as a flashpoint of why we need Medicaid expansion. So, but they still opened the Pride Clinic. So we can tell what they're prioritizing. And this bill, the Senate Bill 560, I think it's not like a perfect silver bullet, but between that law, Nancy, being passed and a couple of lawsuits, which as I understand are in the works, I think that's going to modify some behavior and bring some adults into the room.
Yeah, I agree. I think this bill, a couple of lawsuits, phone calls to legislators, talking with your individual doctors when you go see your doctor. If you have a moment and they're willing to talk, bring up some of these subjects, because a lot of them don't even understand this is happening. Understanding, sharing Riley Gaines's stories and videos with people, understanding how violent, just in the past couple of weeks, the trans violence has gone through the roof. It's very scary. We've seen different Twitter personalities like Billboard Chris get attacked, Riley Gaines get attacked, the tragic shooting in Tennessee a couple of weeks ago.
There's another one too. There's another, there's another.
They stopped someone in Colorado, I think, and then the storming of the Tennessee Capitol. Yep. I mean, just all within a week. And I think as more and more people see this and see this violence and this kind of deranged behavior behind these movements, people are gonna get very tired of it very quickly, and hopefully start picking up the phone and start talking about it and saying, you know what, we need to put the kibosh on this stuff. It's gone too far, too fast. It doesn't work. We know it from, across the pond. And let's return to some sanity here, please.
Right. And if we have to legislate it, so be it. So, well, Nancy, thank you for joining me and joining all of us, because this is kind of fast moving stuff. The Senate has already had their date that they can't, put out any more bills. Of course, that was the week that we went on vacation. And for the House, their last day is April 18th. So do look for a bolus of bills to come out for consideration. I think this is the last week that can happen. So you're going to see a lot of them, and we'll be here again this week to discuss them. And from what I'm hearing, some of these House bills that are going to be pitched are along the same lines as the Senate side. So it just shows the commitment on both sides to get something done to protect children and to protect whistleblowers from standing up.
Yes, exactly. We need to protect our whistleblowers, because there are a lot of good people and good doctors who want to do the right thing, who are just bullied into silence. And it's really unfortunate. And I wish more people understood how many doctors do want to do the right thing, but are just very afraid by the ideological bureaucrats that rule over them. So we got to give them support. And part of that is passing legislation like this, so they have more room to work and to be outspoken and to do the right thing. Yeah, if you're on social media, please give these senators a hand. It's Ralph Heiss, Joyce Krawick is one. I think Warren Daniel is one. Sanderson. Yeah, on the House side, darn near everybody. We really have to support them, really on a daily basis if you can. Call them, write them, give them support. I mean, they're doing the work of the people, and we have to also do our part. So don't think that you can sit on the sidelines and say, "God, that bill isn't perfect. That isn't ready." Look, we're very close to perfect. So we've got to get in there. We've got to support. I've heard from a lot of you saying, unless it's a total ban, I'm not going to support it at all. No, do not do that. Trust me. There are different ways to attack the monster. Different ways, different speeds.
I'm telling you, this Senate Bill 560, it is good. It's going to stop a lot of it. And it's going to avoid some of the legal pitfalls that would actually stop the bill in its tracks. We don't want that to happen. We need something now. So
Right.
again, thank you for joining us. Please share this video. That's how we're getting it out there. We're being obviously shadow banned. You know, who isn't, right, that's telling the truth these days? So please do share and go out there and support your good legislators.
Absolutely.
All right. Thank you.